stop whatever you are doing right now, because if you are currently receiving Social Security benefits, whether through SSI, SSDI, or retirement income, this information could have a meaningful impact on your financial situation in the near future. Across the United States, there has been a growing wave of discussion surrounding a possible increase of up to $650 in Social Security-related benefits. And naturally, millions of Americans are asking the same urgent questions. Is this increase actually real? Who could qualify for it? And when might it take effect? These are not small questions, and the answers are not as simple as a yes or no. What is happening right now is part of a broader, ongoing conversation involving policymakers, economists, and advocacy groups who are responding to a very real and very pressing issue: the rising cost of living and the financial strain it is placing on individuals who depend on fixed incomes. Over the past several years, inflation has significantly affected everyday expenses, including groceries, housing, utilities, and especially healthcare. And for those relying on Social Security benefits, even modest increases in costs can quickly become overwhelming. While Social Security benefits do include annual adjustments through what is known as the Cost of Living Adjustment, or COLA, many experts argue that these increases are not fully keeping pace with the true cost pressures faced by retirees and disabled individuals, particularly when it comes to essential categories like medical care and housing, which tend to rise faster than general inflation measurements. This growing gap between income and expenses is exactly why proposals like a potential $650 increase are gaining attention, because they are intended to provide additional financial relief and help bridge that gap. However, it is very important to understand that the $650 figure being discussed is not currently a confirmed, universal payment that will automatically be sent to all beneficiaries. Instead, it represents a combination of possible changes that could collectively lead to increases of that magnitude for certain individuals depending on their circumstances. These changes could come from several different sources, including adjustments to COLA calculations, recalculations of existing benefits, targeted increases for specific groups such as SSI recipients, and broader legislative reforms aimed at strengthening Social Security programs overall. One of the central elements in this discussion is the way COLA is calculated, which is currently based on the Consumer Price Index. While this system is designed to reflect inflation, critics argue that it does not accurately represent the spending patterns of seniors, who often allocate a larger portion of their income to healthcare and housing costs. Because of this, there have been proposals to adopt an alternative inflation index that better reflects the real expenses faced by older Americans, and if such a change were implemented, it could result in larger annual benefit increases moving forward. Over time, these enhanced adjustments could significantly raise monthly payments, contributing to the kind of increase that is being described in current discussions. Another important factor is benefit recalculation, which involves reviewing and updating the way benefits are calculated for individuals who began receiving payments under older rules or formulas. Millions of Americans fall into this category, and in some cases, they may not be receiving the full amount they would qualify for under updated standards. Lawmakers have been exploring ways to address this issue, particularly for low-income workers and long-term beneficiaries, and if these recalculations are approved, they could result in meaningful increases in monthly benefits. For some individuals, these increases could be substantial, adding hundreds of dollars per month and contributing further to the overall $650 figure being discussed. In addition to these broader adjustments, there is also a strong focus on providing targeted support to SSI recipients who are among the most financially vulnerable groups within the Social Security system. SSI benefits are often very limited and may not be sufficient to cover basic living expenses, especially in high-cost areas. And as a result, there have been proposals to increase federal SSI payment levels, adjust income thresholds, and provide additional supplemental payments to those in need. If these measures move forward, SSI recipients could see noticeable improvements in their monthly income, which again could contribute to the larger increases being talked about. At the same time, SSDI recipients are also part of this conversation, as many individuals receiving disability benefits face unique financial challenges, including high medical expenses and limited opportunities to earn additional income. Lawmakers have recognized these challenges and are considering ways to strengthen SSDI benefits through both general adjustments and targeted reforms, ensuring that individuals with disabilities receive more adequate financial support. When you take all of these factors together, enhanced COLA adjustments, benefit recalculations, targeted SSI increases, and SSDI reforms, it becomes clear that the idea of a $650 increase is not coming from a single policy or payment, but rather from the combined effect of multiple potential changes working together. That being said, eligibility for any increase will depend on several important factors, including your current benefit level, the specific program you are enrolled in, and the timing of any approved changes. Individuals with higher benefit amounts may see larger increases from percentage-based adjustments, while those with lower incomes may benefit more from targeted support programs, and each Social Security program, whether it is retirement, SSI, or SSDI, operates under its own set of rules, meaning that changes may affect each group differently. Timing is also a critical consideration, as some adjustments could take effect at the beginning of a new year, particularly those tied to COLA, while others may be introduced gradually depending on how legislation is implemented. As of now, there is no confirmed nationwide rollout of a flat $650 increase, and it is essential to approach this topic with a clear understanding of what is actually being proposed versus what has already been approved. Unfortunately, there is a significant amount of misinformation circulating, with some sources claiming that payments have already been authorized or are being distributed immediately, which is not accurate at this time. What we are seeing instead is a combination of ongoing discussions, policy proposals, and projected outcomes, all of which are still in various stages of review and debate. This does not mean that increases will not happen, but it does mean that any changes will take time and will need to go through the proper legislative and administrative processes before becoming official. Another important aspect to consider is how an increase in Social Security benefits could affect other forms of assistance, such as SNAP or Medicaid, since eligibility for these programs is often based on total income levels. An increase in one area could potentially lead to adjustments in another, so it is important to look at your overall financial situation and understand how different benefits interact with each other. When we step back and look at the bigger picture, it becomes clear that this discussion is about more than just numbers or policy changes. It is about addressing a growing financial challenge that is affecting millions of Americans who rely on Social Security as their primary source of income. Rising costs have made it increasingly difficult for many individuals to maintain financial stability, and even relatively modest increases in monthly benefits can make a meaningful difference when it comes to covering essential expenses like rent, food, utilities, and medical care. While the idea of a $650 increase may sound promising, it is important to remain realistic and understand that not all proposals become law, and not all changes happen immediately. The best approach at this stage is to stay informed, regularly review your benefit statements, and pay close attention to official announcements from the Social Security Administration. If you are already receiving benefits, this is a good time to ensure that your information is up to date and that you fully understand how your payments are calculated. If you are planning to apply for benefits in the future, keeping track of these developments can help you better prepare for what to expect. Ultimately, the concept of a $650 increase reflects real concerns about affordability and financial security, and while it is not yet a confirmed universal payment, it represents a set of potential changes that could significantly improve the financial outlook for many beneficiaries. The situation is still evolving, and updates could emerge at any time, which is why staying informed is more important than ever. When it comes to your Social Security benefits, knowledge is not just helpful, it is essential because even small changes can have a lasting impact on your financial well being.